My name's Jess. I'm one of the nurses at Dimensional, and I am going to do a tutorial today on how to check a finger stick or a blood glucose. So the first step is making sure that your PMOF is updated. Make sure that you have an actual doctor's order, you know what time to do this, you know the ranges, whether it's too high or too low, and what to do about them per the doctor's order. Make sure that your MAR is also posted appropriately with your latest PMOF, making sure that the orders match and that they're the same. So once you've verified that, you're ready to actually do your finger stick or check your blood sugar. I'm going to show you on myself today, so as you can see, I don't have any gloves on, but you will always wear gloves when you're having anything to do with anyone else's bodily fluids, blood, if you're cleaning up anything. You just want to make sure if you're coming into contact with meds, make sure that you always have on gloves. I, again, don't have on gloves because I'm going to check my own sugar today. So once we get ready to get started, I would recommend getting all of your equipment in the same area so that you have it all together. It's super quick and decreases the amount of time it takes you to do your finger stick. So you want to make sure that you have your meter. You want to make sure that you have your test strips. Make sure that they're not expired. You also want to make sure that you have your lancet, which is your actual needle, and then the little holder that comes with it. They all look a little bit different, but pretty much they're the same. Basically, you just stick your needle inside this little device, and that's what you actually use to prick your finger. So once you make sure that you have all of these things, as also you want to make sure that you have your alcohol swabs. Super important. We want to make sure that we're using proper hygiene with our clients and making sure that we clean off that finger really well before we stick it to get the blood. Okay, so once you have all of your equipment, you're ready to do the actual finger stick. So turn your meter on. Some meters have an on button, some you just stick the test strip right inside. This one is an on button. You want to get your test strip. There's two sides to this, if you can see. There's the little side that has a little window, has a little yellow slot, and then you also have one that looks like a computer chip. The computer chip is what is actually going to go into the meter. That's what the computer knows what to do with. Okay. So this says C25. Basically, it's just saying that that's the type of test strip it is with this type of a meter. So if you can see there, this is telling you, oops, sorry, it's upside down, it's a drop of blood going on to the test strip. So it's telling you it needs a drop of blood. So once you have that set up, then you're going to set up your actual lancet. So again, this is where the needle is, so be super careful because there is actually a needle inside of here. You don't want to prick yourself. So you're going to insert this into the little device. It'll click. You'll hear it click. You want to pull this end off. Oh, goodness, it's not staying. There we go. Twist the end off. You want to twist off the end. So now your needle is exposed, and you want to put the top on your meter or your lancet here. There's numbers here at the bottom. I don't know if you can see those. Those are the depth numbers. So when you're checking someone's glucose, typically these clients hopefully won't be brand new to them. If it is, it is. But on clients who are diabetics and have been diabetics most of their life or for a long period of time, you start to develop calluses on your fingers. Typically these two fingers, which is the fingers most people use to check blood glucose. So you'll notice that they're kind of hard and they're kind of calloused. So if they have those callus, most likely they have decreased sensation here in their fingertips anyway because they've been stuck so many times they get used to it. But if it's someone like that's brand new to this, you also want to keep in mind you want to stay away from the middle of the finger. That's where all the nerves are. So it'll hurt a little bit more, especially for someone who's not used to this. So if we're doing it the first time, or if you don't really know the client and they don't really have those well-developed calluses, just stick towards the outside here and not do it right towards the middle. So before you stick them, you want to make sure that you kind of squeeze a finger. If you can see here, as I'm squeezing, my finger's getting really red. So that's just all the blood kind of rushing to the top of my finger. So then you'll know you'll get your drop out. It won't be very difficult. It'll be super easy to get it. And that's kind of the goal here, is easy. You don't want to have to do it too hard. So kind of pump the finger here, make sure you get it really red. You're going to take your alcohol swab, and you're going to wipe the tip of the finger and dispose of it. You're going to want to wait for this dries. It only takes like a couple seconds to dry, so just wait a couple seconds for it to dry. Don't blow on it because then you're blowing your bacteria onto their finger. That's not helping anything. So make sure that you don't blow on it. So my finger's dry now. I'm going to take my little lancet holder. Blue button is what kind of pushes that needle forward. So you're going to hold this down to the skin. You're going to push your blue button. Listen for the sound. Okay, so it made that little sound. That means that that needle went out and has come back in. So there's a safety device at the end of this meter here, or not the meter, I'm sorry, the lancet holder, so where you won't poke yourself, but you just want to be super careful that you keep in mind that you have stuck someone in the finger and there is a needle in there. So once you do that, you're going to have a little bit of blood come out of the finger. You're going to wipe away the first drop, so you want to grab like a 2x2 or a tissue or paper towel or something, wipe away that first drop, squeeze the finger out a little bit more, get your drop of blood here on the finger, and then you're going to want to come in kind of at a 45-degree angle. You don't want to come in like this, and you don't want to come in like this. Too shallow, and the blood's going to absorb here on the bottom of the strip on the back side, and you're not going to get a reading, and you're going to have to do this all again. So just come in at like a 45-degree angle like you would maybe like if you were scooping something up. So hold it to the end of the finger, it'll absorb the blood, it'll go into the meter, and then the meter will give you a number. So after that, you're all done. Most of the time our clients don't want anything for their finger. Should they want a Band-Aid, you're more than welcome to put a Band-Aid on it. They can put a little pressure on it. Most clients, I really haven't come into contact with anyone who really needs anything. But just make sure that you are watching for the for bleeding. So if it is bleeding a lot, you want to hold a little bit of pressure on there with a 2x2 or a Band-Aid or something. But if you notice that the client just kind of holds on to it, walks away, and it's good, then you're fine with that. So then as far as the number goes, you want to make sure that you write down this number on the MAR, on the spot on the MAR for this at the appropriate time. And then again, depending upon the range, if it's too high or too low, whatever the doctor specifies will be on that MAR and the PMOF. You want to make sure that you follow those orders. So too high or too low, you're going to call the nurse at dimensional, and then it's going to give you kind of instructions on the PMOF, what to do from there. But anything in between those two numbers, you just document and continue about your day. If they get sliding scale, then you're going to want to see how much sliding scale correlates to that number. If they don't get any insulin and it's just to check, then again, you just continue about your day. It's all client dependent, so you just definitely need to know your client and their specific needs related to this blood glucose value. So that is the tutorial on how to check a blood sugar. I hope it was informative, and thank you so much.